I said before there's no cure for tinnitus, but there are treatments. So I want to talk about two of the treatments that we use the most in our office. The first one is hearing aids. There are many different brands of hearing aids out there. Everyone's different. A hearing aid that might help one patient might not help the next patient. So at our clinic, we usually test our tinnitus patients with a bunch of different brands to see which brand will lower their tinnitus the most or get rid of it. It's not often that it gets rid of it completely, but there are some patients who have reported that their tinnitus has gone away. The second thing is cognitive behavioral therapy. Now, I don't personally deliver cognitive behavioral therapy, so we would usually recommend you to a healthcare provider who can do that. But I know there are some people who don't have access to a healthcare provider. They might live somewhere remote where they don't have healthcare providers. They may not have insurance. They may not be able to afford it. So there are a bunch of programs that you can get that do have cognitive behavioral therapy. It's not always called cognitive behavioral therapy because obviously legally they can't call it that if there's not a provider attached to it. But there are some programs that you can look into that you would use in conjunction with your hearing aids to help you with your tinnitus. So just look in the link below and I'll list a couple that I know about. If you know of anything, list it below so that you can share.